It's X107.1. We are Cayman's #1 hit music station. Morning, you got me, Dave, on for your Friday with a couple of guests in the studio this morning as well. We've got Susan, who's a midwife at Doctor's Hospital, and Katy, who's a lactation consultant at Integra. How are you both? Are you well?
We're
Yeah,
good.
we're good, thanks.
Good. So we're here this morning to talk about how I didn't realise that Doctor's Hospital and Integra actually work together hand in hand. So how does that work with you guys then?
Yeah. I think, so I'm Sue, I'm midwife at Doctor's Hospital, and Katy basically starts at the very beginning of mum's pregnancy journey,
Okay.
and also to the end. We do the bit in the middle of
Right.
DH.
Okay.
So yeah.
But it's a great continuity because you get the best of all worlds, right? We're not here to just support your birth. We're here to support your antenatal journey of how do you prep to learn to birth your baby in the way that you want to with good informed consent, and how do you feed your baby, and then we get to follow you into the community if that's what you want.
So how does it all work then? Because in the UK, you just go to the NHS and it just happens. But obviously here, you choose where you want to go, and then it all sort of takes off from there. So if a lady's listening now who's pregnant, how would it work to come to either Integra or Doctor's Hospital?
So the mums will choose. Normally, they'll choose their OB first, obstetrician. And for us, it'll be our doctors at Integra that they'll choose, or the obstetrician at Doctor's Hospital.
Yeah.
And it goes from there. So depending on their preference, they choose where they want to go. Hopefully they'll come and see us and see Katy. So they move from there. And during that process, not only will they see their obstetricians, they'll actually get to see Katy as well at the beginning, and then we kick in a little bit later on.
Now, obviously, there's a lot that goes on with having a baby and stuff, and there's also help that you give to people after they've been discharged as well. So how does that work?
I think that's probably a little bit more of my role.
You do that, yeah.
One thing that's really great about Integra and my role now is that you don't have to be an Integra client or a Doctor's Hospital client to access me. So if you're you're living on the island and you are having any type of feeding difficulty, it doesn't have to be breastfeeding difficulty. You can reach out and book online, and you can call Integra and come and see me and talk about what your feeding goals are. And a lot of what I do too, it can involve home visits. So if you maybe have had a really difficult delivery and you're not feeling like you can come into clinic, I'd be more than happy to come see you in your home.
Amazing. So what's it between the both of you? What's the one key message you want to give to anyone that's expecting a baby right now?
For me, make sure, come to antenatal classes, get that information on board.
Yeah.
Know what to expect. Make sure that we can manage mum's expectations, dad's expectations. So really, that is from right at the beginning. And if they want to come to our classes, please contact us early. We get full up very quickly. We're very popular. And we go, so the midwives will go through things for antenatal care, intrapartum, so labour and birth, all of those things. We also talk about breastfeeding or any infant feeding, depends on mum's choices, and also some of the postnatal care as well. Hopefully we'll be getting Katy. So Katy's fairly new to Ireland, but we'll be getting Katy involved in those classes as well. So we do them on a Monday, every other month at the moment, 2 hours of their evening. And it's fun, it's informative, and we'll answer any questions that they've got.
I've got a question.
Go on.
What's Kangaroo Care?
Kangaroo Care. Oh, this is my passion.
I've never heard of it. What is
my
this?
passion. You've seen a kangaroo with
Yeah.
their baby in the pouch.
Yeah.
Okay, so at Doctor's Hospital, we have a cardigan, a Kanga cardi,
Yeah.
and it wraps around the mum. We offer it to Kangaroo Care.
I think
to
I've
all
seen
mums.
people walk around with these.
These are designed for midwives for hospital use.
Okay.
So these aren't for home care. They're not. These particular cardies are not for moving around.
Okay.
So they're more for mums who have to go into OR to have a cesarean.
Okay.
And basically, we don't want to separate mums and babies, and that goes on mummy before they go in. And then when baby's born, we, as long as mum and baby are well, we tuck the baby in the little cardi.
That's amazing.
Here, you can't see what I'm doing, obviously. Tuck
It looks
the
good,
baby.
don't just say no. Yeah.
Very funny. And a lot of these babies
Wow.
actually breastfeed before they even leave the OR. So yeah, it's really important we don't separate mums and babies and dads, if dads are there as well. They get skin to skin, but they don't get to use our lovely little Kanga cardies. And we were really, I've got to say, we're really grateful for the hospital in the UK that designed them and actually gifted them to us. You can't get them anymore.
Amazing.
So it's brilliant.
I appreciate you both coming in and opening up this thing for everyone to talk about on the radio, and good luck with it moving forward. Thanks for coming in.
Lovely. Thank you.
And if you want to learn more about Integra Healthcare or Doctors Hospital, you can search either integra.ky or doctorshospital.ky and see what they can do for you.